Hello everyone, this is Dr. J back again with the Human Movement Institute, where we have improvement through movement. Today we will be discussing brachialis muscle mobilization exercise. This is a procedure and or technique to relieve front outer arm pain and or anterior elbow pain. And believe it or not, this muscle, due to its anatomy, can even cause pain in the anatomical snuff box area or around the dorsolateral aspect of the thumb. Let us not forget the origin insertion of the brachialis muscle. It starts on the anterior surface of the mid to distal humerus, right where the deltoid connects to the deltoid tuberosity. So this muscle starts much higher than we often think. It's also a broad, flatter-like muscle that connects to the septum, the intermuscular septum, the medial and lateral aspects of it on the anterior aspect of the humerus. It traverses or travels distally and inserts onto the coronoid process of the ulna. In fact, if you flex the elbow, you can feel the tendon of the brachialis on the ulna, the anterior proximal aspect of the ulna, known as the coronoid process. Just lateral to that is biceps brachii. With that said, we must remember to access the brachialis, it lives under the biceps brachii. So if I activate my biceps and then flex my elbow, I can feel a muscle contract or engage under the biceps. That is indeed the brachialis muscle. It is known as the anatomical snuff box scourge muscle. So let's make sure that we know how to mobilize it, and let's make sure we're treating it with an accurate human movement diagnosis. To find it, I can engage the triceps or the biceps brachii and then go in between the two muscles on the anterior aspect of the humerus. I can go with fiber. I can also work cross fiber. Personally, I like to use my own digits, my own fingers to mobilize this muscle, while others prefer a mobility tool. I can do active release by flexing the elbow and then extending the elbow for audiogenic and reciprocal inhibition. You'll know if the brachialis is involved because of the pain where you mobilize the musculature. If this reproduces your pain and or it starts to reproduce anterior elbow or base of thumb pain, you'll know that you're on the right muscle, brachialis. Brachialis is unique in that it's a dually innervated muscle. While it's primarily innervated by the musculocutaneous nerve that comes off the lateral cord of the brachial plexus, starts at C5-6 nerve root in your neck, the inferior portion is innervated by the radial nerve. Thus, we have a muscle that's dually innervated. After initial starting dose of 5 to 10 minutes, once a day or every other day, we might find that we start to get relief of front upper arm, anterior elbow, or base of thumb pain. It's also a muscle that is known as the powerhouse of elbow flexion, or the workhorse of elbow flexion, as EMG studies have shown that it's the primary elbow flexor. So to offload this muscle, we could limit how much we're lifting with thumb up and palm up, decrease the load or the repetition, and for a week or two, work with elbow flexion with palm down. Specifically, if you have a job or you're doing workouts where you're activating the elbow flexors. If you've liked our Brachialis muscle mobilization video, please share it with your friends, family, patients, and colleagues. Take care and see you all again soon. Bye-bye.